Hi everyone, I'm Eileen. Welcome back to this podcast series, Spill the Health, Real Talk, Real Health. Today we'll have our Dr. Kua to share about some information about breast cancer during this Breast Cancer Awareness Month.
Hi everybody, I'm Dr. Kua.
Doctor, I would like to bring out something that I have curious about for so many years. Is that since young I have been heard people saying that wearing a wired bra is not good for female, and then so nowadays market come with a lot of wireless bra. So do doctor think that is really that the materials of the bra will affect the risk of cancer, breast cancer?
No, this is a myth. Do not believe this kind of myth. There's actually scientific evidence that proves that there is no relationship between the breast cancer incidence and underwire bra or any material bra. They will say you cannot wear certain types of bra because of bad material, heat, build up of toxin. I do not think this is very true. In fact, the Breast Cancer Foundation already has a study that proves that there is no scientific linkage between breast cancer and the types of bra that the patient has.
So thank you, Dr. Kua, for resolving the curious that I have for so many years. Does breast massage help to prevent breast cancer or detect the lumps?
No, breast massage does not prevent breast cancer. Breast massage is good for improved lymphatic flow, to ease breastfeeding pain, and also to reduce tension. But however, it does not prevent breast cancer. Okay, but it does help to detect a lump, because if a patient is always doing breast massage, they are very familiar with their breast. So every day when they breast massage, they are familiar. Then when one day suddenly they notice that something is different, that there is a bulge, a hardening, then that sort of let patient to seek the doctor earlier, and in a certain way it helps with the diagnosis. So earlier diagnosis, better treatment and better cure rate.
So every day the monitoring of every day is very important.
Yes.
Doctor, can someone with breast cancer still breastfeed after surgery or radiation?
Yes, this is a very challenging question, because if you have a treatment on one side of the breast, there is always the other side, contralateral breast, where you can still breastfeed. But again, there is a lot of other factors into this. Number one, for the same side of the breast, it depends on what surgery has been done. If the patient has mastectomy done, then obviously there's no breast, so then you can't breastfeed on the side with the breast cancer. And if lumpectomy done means that part of the lump has been removed but the breast is still intact, then yes, but you can breastfeed, but then the production of milk will be less. It's very challenging because the breast tissue is less, so the lobules to produce the breast milk and the duct also less. So it's very challenging for the mother. And on top of that, patient who has lumpectomy will need radiation. So radiation causes a lot of fibrosis, means hardening of the tissue, and this makes breast production even more difficult. Okay, and last but not least, most of these patients will have some form of treatment, especially hormone receptor positive patient. They will be taking medication, and all this medication will leak into the breast milk and pass it down to the baby. So it's very important to know all these details, very important to discuss with the doctor, oncologist, to see whether the patient is suitable to breastfeed.
So it is important to seek advice from oncologists before planning for breastfeeding. Doctor, will breast cancer affect someone's fertilities?
Yes, definitely will affect. It depends on age and also the type of treatment that patient have. So in terms of age, if the patient is younger, then the ovarian reserve is more. So with treatment, sometimes part of the ovary function is affected, but the reserve is a lot more. So your reversal of fertility is higher. But for an older lady, that will be more difficult because the timeline, the age of the ovary is older, so the reserve is less. And then second is the type of treatment. So if patient have chemotherapy, then the chemotherapy drugs will definitely destroy the ovarian cell, and this will lead to permanent or temporary infertility, and also will cause premature menopause. But however, I do have patients who had chemo and then eventually get pregnant. So this depends on the types of drug, depends on the patient's ovary reserve also. Then in terms of surgery and radiation, if patient have radiation and surgery of the breast, it doesn't affect fertility. But some patients, they have to remove the ovary or do radiotherapy to the ovary to bring down the hormone so as to treat the breast cancer. Then that of course will affect the fertility because you do surgery and radiotherapy to the ovary. So then the last is hormone therapy. Hormone therapy doesn't affect infertility, but it lowers the fertility rate. Means that the patient can still get pregnant. I have patients on hormone therapy who accidentally get pregnant, which we don't encourage because the hormone drugs will cause problem for the fetus, the baby in the stomach. Yeah, so contraception is very important while patient is on the hormone treatment. So it is very important that the patient go and talk to the oncologist about their fertility plans, and also very good if patient can see a fertility specialist to see what are the options available. So there are some options available. For example, number one, egg preservation or embryo preservation, so they can save their egg for future use. Or some of them even have ovarian tissue preservation, where in which they cut a piece of the ovary and keep the tissue for later use. And the third one is some of the patients, I would suggest them to do a hormone injection. We call it GnRH analog. This one is to decrease the activity of the ovary so that the chemo will not go and attack the ovary and thus end up preserving the fertility.
Breast cancer patients are encouraged to talk about fertility with their doctors. Doctor, should someone delay the pregnancy after receiving the treatment?
Yes, they should delay the pregnancy. Usually I recommend 2 years, but again, that's not the standard. Okay, the reason why we need to wait for 2 years is because there is a risk of recurrence. The first 2 years, the risk is higher. Okay, so if the risk is higher and patient is pregnant, then the treatment will get a bit difficult because we have to talk to patient about termination of the pregnancy if in case patient is pregnant and the cancer recur. We also have to talk about doing chemo while patient is pregnant, affecting the baby. So there's a lot of issues if patient do get pregnant when during the first 2 years, and the patient is on the higher risk of having recurrence. Well, also depends on the age. If the patient is older, let's say she's 40 years old already, she don't have much time. So for her, it's quite urgent that she want to get pregnant. So for this patient, we will discuss with patient, there is increased risk, but because of your age, then there is a risk to take. But if patient is very young, at 25, then there's no problem to wait a bit because they're still young. They can always get pregnant, when they're in the late 20s or 30s. And also depends on the stage. If let's say patient is stage 3, the risk of recurrence is so high. So especially the first 2 years, then those patients we don't encourage to get pregnant too soon because the risk of recurrence is so high. We don't want to run into the problem later. So the third type is it depends on the type of breast cancer. So if the hormone receptor positive patient, they need to take some hormone treatment while they are on the first few years, actually 5 to 10 years. So if they get pregnant while they are on hormone, then it will affect the formation of the baby. The baby might be born with some disability. So we don't encourage them.
Women who are facing breast cancer often have to make difficult decisions, so seek medical advice or delay in pregnancy. Because of the new life continues to bloom in the womb, how do I know whether the lump is a cancer or just hormonal changes?
Well, for a lady to differentiate whether the lump is cancerous, is it cancer or not, is actually very difficult. So it is very important that you need to see a doctor if you felt something abnormal. You felt a lump, you can see a doctor, and the doctor will do ultrasound and mammogram. But even with ultrasound mammogram, we also cannot be very sure. So biopsy is very important. But as a doctor, because we have seen so many breast patients with breast lump, so roughly we sort of able to tell the difference. So a lump that is cancerous is usually very hard. The edges are irregular a bit, and sometimes it's fixed, means that when you touch it, it doesn't run around, it's quite fixed. Okay, and it is always there persistent, means that whether you check it tomorrow, you check it next week, the lump is there, and sometimes it's even growing. So if it's due to hormonal changes, usually it's softer, rounder, and it will be not persistent, means that sometimes it's there, sometimes it's not there. When the hormone is up, it's bigger. When the hormone down, it's disappeared. So usually it's this that we decide on, but there are a few serious warnings. Number one is when there is nipple discharge, when there is blood coming out from the nipple. And number two, there's nipple immersion, means the nipple gets pulled in, and the skin, we call this pure deorange, means that the skin is wrinkled up and looks like orange. Okay, these are all serious signs that we need to know. And then another one is the lump is growing bigger and bigger over time, or sometimes there is another lump in the armpit that spread to the lymph nodes. So these are all the serious warning which we need to see a doctor as fast as possible.
So it is important for us to monitor our body changes from time to time for early detection. Doctor, will I lose my breast completely if I'm being diagnosed with breast cancer?
No, there are options available. Besides mastectomy, which means removing the whole breast, there's another surgery we call a lumpectomy or white local excision. Basically, is to remove the breast lump with some surrounding breast tissue, but the breast is still intact. But patient who has lumpectomy must have radiotherapy together. Okay, so this is very important. They must do it lumpectomy and radiation if they don't want to do a full mastectomy. But again, the choice of surgery, it depends on a few factors, and very important is that the patient must discuss with the surgeon. Okay, because the size matters. If the breast lump is very big, like 7 cm, and the breast is quite small, there is basically not enough normal breast to be left behind. So this kind of patient will need a mastectomy. And then a patient with advanced stage, then it's better to get the breast removed, the full breast removed, because clearance is better. Otherwise, they end up having to go in a second time round. And also, if there's multiple small cancer in one breast, so if there's one in the upper quadrant, one in the lower quadrant, there's a few scars on the breast, then no point preserving the breast, then better to have mastectomy. On top of that, I'd like to add that if patient have mastectomy, there's always a consideration for reconstruction. So do not avoid the surgery if you have to. If you have to do mastectomy, it's for the best of your health, then you should do it, and then can consider reconstruction after that.
Don't afraid to lose your breast. Your health is most important things in your life. Does nipple discharge always mean something serious?
No, nipple discharge doesn't always mean something serious. There are normal conditions where patients will have nipple discharge, for example during pregnancy or during breastfeeding or during stimulation. Okay? There are also benign, non-cancerous conditions where patients can have discharge, for example like infection, okay, or hormonal changes. Sometimes during our menses, hormonal disruption also can cause nipple discharge. There's some medication also can cause nipple discharge. There's also a condition called galactorrhea, which is a milky discharge for a patient who has high prolactin level. Okay, so these are benign conditions and doesn't tell us that it's cancerous. Okay, but when the nipple discharge gets serious or is a warning sign, is when it's bloody, okay, or when patient actually have a lump and then there's discharge, or the skin of the nipple doesn't look healthy, there is like a redness, inflamed, those also needs to come and see a doctor. Or patient already have a, let's say, mammogram or ultrasound, already show that there is a mass, and then now they have discharge. Then obviously something has gone wrong. Maybe the lump has grown, has become cancer. So this kind of nipple discharges situation, the patient should come and see a doctor.
So is it like the persistence of the discharge? You need to take note.
Yeah. If patient persistently have discharge and you feel that something is abnormal, it's okay to see a doctor. The doctor can help to decide whether this is serious.
Don't panic, don't guess. Always seek for medical advice. So doctor, when is the best of the time in the month to do the breast examination?
Well, it depends on whether the lady is premenopausal or postmenopausal. If the lady is premenopausal, she have her monthly menses. So you recommend that 3 to 5 days after the monthly menses to do the examination, the self-breast examination, and try to keep it consistent. Means do it every month, and make sure it's about the same time every month. For postmenopausal lady, they have no menses, so it's very difficult to gauge when to do it. So we do suggest that if they plan to do it the first week of the month, then it should be every time first week of the month. Consistency is very important because your body changes. Although maybe the postmenopausal lady no longer have period, but we still have hormones. So sometimes the breast density, the fullness changes over time. So if you do it consistently the same time every month, then you are familiar what is normal and what is not normal.
So it is important to like fix a time or date every month to do the breast
Yes,
examination.
put it in the calendar. Make sure it's an important part of your life.
Make self-examination a regular habit to stay aware of any changes of your body. Set the reminder now. Spill the health, real talk, real health.